Menopause-related hair loss can have a significant impact on the individual, because not only do you have the impact of having reduced estrogen in your system and the different dynamic of hormones that can impact one's mood, but you also have the physical signs and effects of that menopause, of which one of them is hair loss. Up to 40% of women by menopausal ages within, their early 40s will be experiencing some degree of hair loss. What is menopause-induced hair loss? Well, females going through menopause can experience hair loss, and it can happen for a couple of reasons. It can be that because of the reduction in estrogen, you then have more of an impact of some of the other sex-related hormones, or some of the other androgens is what they're called, like testosterone, for instance. Now, if you look at any pregnant woman, you'll generally see a very thick, luscious head of hair. The reason being is that estrogen is actually pro-hair growth, fullness, thickness, nourishment. Hair loves estrogen. So what happens in menopause, when your estrogen levels drop off significantly and you no longer have that protective estrogen effect? And so what that then leads to is an imbalance between estrogen and other sex hormones or androgens like testosterone, for instance. And we all know that testosterone can have a negative effect on the growth of hair. So what happens is, as estrogen drops off, you can have a reduction in the volume of your hair. Your hair growth cycle can then shorten from being, 2 to 6 years to shorter, sometimes months. And so what women will notice is that their hair starts to feel thin, it starts to feel brittle, they can start to see more scalp through the hairline, and you can get a widening of the part. Some females actually experience hair loss all over the scalp, so more diffuse hair loss where it's actually happening everywhere and not just in one isolated spot. Some people that have an underlying genetic predisposition of female pattern loss actually might find that is exposed, because when they're shedding more hair and losing more hair in this postmenopausal or perimenopausal phase, might notice that then an underlying genetic predisposition to hair loss is then brought closer to the surface. So you can start to notice that you're thinner in the crown area, you're thinner in the middle of the part, sometimes at the front of the hairline. So when estrogen drops off, you get an increased impact from other hormones like testosterone that can have a negative effect on the hair. You can also get increases in inflammation at the level of the scalp and dryness of the skin. So that's another component, increased inflammation at the level of the scalp. And also reduced blood flow to the scalp. So reduced blood flow to the scalp, where you have miniaturization of the hair follicles themselves. You can see a worsening effect on the hair. So menopause-induced hair loss can be helped by improving the nourishment that the hair follicles get. So like in HRP, we improve blood flow to the level of the scalp. We improve nourishment to the scalp through ensuring that the blood vessels heading into the scalp are as full and as open and as patent as possible through mechanical stimulation of the scalp. We ensure that patients are on the right supplement to ensure they're getting all the nutrients that the hair follicles need to thrive and survive. And then we also ensure that we're using the right topical agents to make sure that your hair has a better opportunity to survive, not just immediately, but for a longer period of time. So there's lots of things that you can do to help with menopause-related hair loss. If it's something that you're suffering from and you want to have a complimentary consultation with one of our doctors to discuss what can be done for you, click the links in our bio and we'd love to be able to help.